Hi, my name is Chris Centeno. I'm a physician that has been doing orthopedic stem cell work longer than any other physician in the United States. I invented much of this field. I'm going to share with you the top things you need to know to make sure you get a quality stem cell procedure and maximize your chances of a successful outcome. One of the things you have to be careful of with stem cell injections is the medical specialty of the doctor. You might see an orthopedic surgeon, you might see a pain doctor, you might see a chiropractor. But it's very, very important that that doctor has training in advanced imaging placement of needles and cells. What you see all around you is equipment that's used to get those cells into very specific spots, and you don't come with that training. If you're an orthopedic surgeon, you don't know how to use any of this equipment unless you've trained specifically on this equipment. And that's less than 1% of orthopedic surgeons in the United States. If you're a family doctor, you don't know how to use this equipment unless you've trained on it. If you're a nurse practitioner, you don't know how to use this equipment unless you've trained on it. So again, it's not so much the medical specialty, that should be something involving the musculoskeletal system, but it's more the training. In research labs, just like this one, and this is our research lab, it's been determined that the best source for stem cells to treat orthopedic conditions is bone marrow. So that's why we use bone marrow. Fat just doesn't work as well. Those cells are not as able to do things like cartilage repair and tendon repair. And other sources like amniotic tissue, etc., are not built to do that kind of work. How you get the stem cells out is really critical. Let's just take a bone marrow aspiration, which is when we get stem cells from the bone marrow. What's really important about that is making sure that you have guidance. And what I mean by that is that you're using ultrasound or X-ray to make sure that you're getting to the right spot. In addition to that, it's critical that you go to a lot of spots. A lot of doctors just take one spot. We've known for many years that that's the wrong way to do a bone marrow aspirate. We've known that that reduces the number of stem cells you get, but they do it because it's easy for the doctor. And that's not the way we do it at Regenexx. We do what's best for you, not what's easy for the doctor. So that means going to multiple sites in order to get more cells. So in no other area of medicine is it okay to have no idea of the dose of what you're injecting. Obviously, in every area of medicine, we know the dose of what it is we put into a patient's body. But in cell therapy, frequently the doctor has no idea of the dose. He has no idea of what dose is required. In sophisticated research labs like this, we've been able to determine what the dose is, and we can count that dose on every single stem cell procedure. So that's a critical component to having this be successful. So imaging is critical in getting this stuff, the stem cells, to the right spot. It's not going to get there through some magic carpet ride or through some property of magic pixie dust. It's got to be placed in that precise location. So we use these things to do that. We use a C-arm fluoroscope here, which you can see in the background, which allows us to place stem cells into specific areas of the spine. Or we can use musculoskeletal ultrasound to place it into tendons and ligaments and things like that that can be best seen with this device. And it's really having both so that we can use one technology for a certain set of things and another technology where it excels in another area. So interestingly enough, just the type of anesthetic your doctor chooses to use can make the difference between a dead stem cell and a live stem cell. So as an example, if your doctor uses something like bupivacaine or Marcaine, which is a very common anesthetic, that's going to kill your stem cells. On the other hand, if your doctor uses ropivacaine at a certain concentration, that's going to be fine with your stem cells. So it seems like a little thing, but just the choice of anesthetic can make the difference between an unsuccessful procedure and a procedure that works great. One of the most important things that we do as doctors is to make sure that what we're telling our patients is real, that it's not just some fiction concocted to sell a procedure. So to make sure that it's real for Regenexx, we have this type of sophisticated university-style lab where we have real research scientists doing this work to make sure that what we're doing is actually the real thing. Again, no one else has got that. You certainly are not going to see that from a chiropractor who has a nurse practitioner coming into the office. You're certainly not going to see that at your orthopedic surgeon's office. At Regenexx, we've looked at the long-term safety of our bone marrow stem cell procedure through a nonprofit registry just like this. And we've tracked 2,372 patients or 3,000 procedures out to 9 years to make sure that we know that this stuff is safe. So again, it's what makes Regenexx very different.